Hello, welcome back. The topic today we are going to see is obesity and depression, anxiety, and obesity and psychiatric illnesses. We all know obese people are always depressed or little anxious, and obesity leads to depression and anxiety. And again, anxiety and depression can lead to obesity. Most of the obese people, they have a lack of confidence, they have inferiority complex, they feel they are worthless. These kind of negative attitudes they will mostly have. So this leads to depression, anxiety. Why this happens? In the previous videos, obesity causes inflammation in the cellular level. Throughout the body, the cellular level, there is an inflammation. And especially in obese people, the neuroinflammation, the nerve level or the brain level inflammation is very high. So that leads to depression and anxiety. Of course, in obesity, there is a resistance of insulin, hyperinsulinemia, and a resistance to leptin. These things also lead to this kind of neuroinflammation. And the gut flora, very important. Obese people have a imbalance in the gut flora, which leads to the probiotic, what we call. These leads to neuroinflammation. So these are the reasons why they go for depression, anxiety, this kind of thing. Usually it's like atypical depression, we say. They have a hyperphagia, they eat a lot, hypersomnia, they sleep a lot. How we can observe this is usually the morning time, if you see their food intake is very less. As days goes by, after the sunset, they become very active and they start eating a lot, especially their sugary items, so a lot of sugar and a lot of fat. Again, this sugar and fat diet again causes inflammation in the gut. Not only that can also cause the neuroinflammation. So the diet also very important for their inflammation. But the thing is, why they take this sugary or fatty meal is, see, when they have this kind of food, immediately the blood sugar level increases. When the blood sugar level increases, it goes to the brain and it releases endorphins. Endorphins are like morphines. These morphine, when released, they feel a temporary elation, temporary good feel. They get good sleep. So they train themselves to eat these kind of food, especially in the night time, to get food and get comfort. They go to the comfort zone. Usually, how to observe these people who are depressed is, usually their friend circle is very, very limited. They have one or two friends. They build a castle around them. They don't come out of that castle. Then they keep only one or two friends. And whenever somebody invites them for a party or some function, they will say, "Oh, I will come. 2 days be early itself." They will do blah blah. But then the last moment, they will give an excuse, a lame excuse that they are busy, so they won't turn up for the friends meet or function and all. So this is kind of a first sign to say they are going for depression and anxiety. The first is late night, after the sunset, the food intake is increases. Then they don't mingle with society, friends, they avoid friends, society, function. Next is, usually these obese people, because of their depression, their behavior changes. They try to show outside the world that they are happy, they are well educated, well knowledgeable person, they want to show. So it's suppose, in an example, suppose they are waiting for a doctor somewhere, sitting for a long time, and it takes longer time, beyond the appointment time. They get easily irritated and get anger. They shout at people, why this is all not happening. The reason is they think they are exposed to so many people. They think the people are observing them. So that makes them vulnerable. That makes them anxious. So they try to show themselves as they are very strong. Their anger, they show their strength by showing their anger. So these are the signs and symptoms, and they have a morning time, they will be sleeping, or in the late night till early morning, they will go for sleep. These are the signs and symptoms. These may not be seen observed by the people around them, but if the patient, the obese person, has these things, it's very, they should understand these things and they should ask for help to the bariatric surgeon, the obesity surgeon, as well as to the psychiatrist. Both can help them to reduce the weight and to cope up with the depression and anxiety. And once you reduce the weight by diet, exercise, or bariatric surgery, whatever the thing, usually these anxiety, depression, everything usually goes up. And especially in women, according to their monthly cycles, and the depression, mood swings, can be really troublesome to them. And for women, and not only women, even for the men, finding the right dress, right shoes, traveling in the public transport, all these things makes them more anxious and more depressed. So to come out of this depression, first thing is the person itself, himself or herself, should understand, accept, and ask for help. And by reducing the weight, it's 100% possible to come out of this anxiety and depression. Like any, with the previous videos we were told you, obesity causes directly 40 diseases, including diabetes, hypertension, infertility, cancer. Like this, the depression, anxiety, all these things could be a reason for the obesity. And once we treat that, ultimately the depression and anxiety easily can be treated. Thank you.